Bismillahirrahmanirrahim. Today the topic of our discussion is how to manage a patient with hypoglycemia in pediatric. The 2-3 points to be noted. The first one, our target blood glucose level should be at equal to more than 45 mg per deciliter, and the glucose dose should be started 200 mg per kg, 10% dextrose at 2 ml per kg. Our IV infusion rate should be 5 to 8 mg per kg per minute at the dose of 80 to 100 ml per kg per day. Rate of dextrose infusion in mg per kg per minute should be calculated with this formula. Percentage of glucose multiplied by dose at ml per kg per day divided by 144. You will have multiple options when you face hypoglycemia. The number one is you will give the IV bolus of 10% dextrose water. 10% dextrose water to a patient with hypoglycemia at the dose of 2 to 5 ml per kg. And the second option is you will start the infusion. Infusion rate of 10% dextrose water should be calculated by the given formula above, and increase infusion started at 4 to 6 mg. Infusion rate started at 4 to 6 mg per kg per minutes. Up to the dose of glucose should be 2.4 to 3.6 ml per kg per hour. Okay, and increase your infusion rate by 2 mg per kg per minutes, mean 1.2 ml per kg per hour of 10% dextrose after every reading of blood glucose done with glucose tricks. Up to maximum of your infusion rate should be at 15 to 20 mg per kg per minutes. Mean your glucose concentration will be, when your infusion will be 15 to 20 mg per kg per minutes, your glucose concentration becomes 9 to 12 ml per kg per hour. Okay, monitor glucose reading after every first hour, then 4 hours, after 4 hours, then 2 hourly, until your 2 consecutive readings become normal. And if your baby was asymptomatic, you will hand over the baby to mother to continue oral feed. But if your baby was symptomatic, multiple symptoms, jitteriness, pallor, sweating, tremors, and even if patient has seizures, then you will continue the infusion and don't stop the infusion rapidly. But if your patient cannot maintain his blood glucose level up to this rate of your infusion, mean if patient becomes refractory to this dose, mean up to 20 mg per kg per minute, and your patient blood glucose is not become normal, 2 consecutive readings are not normal, then you will have the third option. The third option is you will start IV hydrocortisone. IV hydrocortisone at the dose of 2 to 5 mg per kg per dose, 12 hourly. Okay, this is your third option. And fourth option multiple drugs are used if you have that are diazoxide. Fourth option is diazoxide at the dose of 5 mg per kg per dose, 12 hourly. Okay, and the other drug options are number 1 diazoxide, number 2 somatostatin analogues. Somatostatin analogues at the dose of 2 to 5 microgram per kg. And if your hypoglycemia becomes refractory up to this step-by-step treatment, you will consult your endocrinologist and consult a surgeon for possible subtotal or partial pancreatectomy. That's it. Thank you very much.